when you click this video away, please tell me what the reason was so that I can improve. Otherwise, hi and welcome. I'm trying to learn medicine. Today, Atrial Fibrosis. And after we've done it, we're gonna do stretching. And if you participate in the stretching, then it's at your own risk. And we're talking about internal anatomy and the blood system and blood vessels and diseases. And this is part 2 of the atrial thrombosis, and this is no medical advice. We're just trying to understand the text and trying to understand it. And now we're trying to gather the information together. We already read it in the first part, and we try to make a presentation out of it, out of memory. So, atrial thrombosis. Clotting of blood in a short segment of an artery which completely obstructs the normal flow of the heart. Okay, atrial thrombosis in a short segment of an artery somewhere. The blood flow is obstructed, so no blood is flowing anymore. Heart, brain and leg arteries are the most commonly affected, but any artery can be involved. For arterial thrombosis of the leg, see intermittent claudication. Symptoms: sudden onset of pain, usually in a limb and when at rest. Can it also happen when a person is exercising? But I think, and it would be interesting if it happens more likely during the moment when someone is exercising or not. Otherwise, is it just randomly, and it is just that the person is 99% not exercising, 99% of the time. Okay, we're gonna stay a bit away from the when at rest part. I think they mean it just starts out of nowhere. We're just gonna say sudden onset of pain in a limb or something. The affected limb is colder and paler than the other. Sudden onset of pain and the limb is colder and more pale. Causes: usually atheroma. And atheroma is a degenerative condition which begins in early adult life and causes increasing symptoms with age. Atheroma was that fatty deposits are at the insides of the arteries, and that leads to sclerosis and hardening of the arteries. Fatty deposits develop on the artery walls, which when hardened, producing the condition known as sclerosis. The deposits enlarge into plaques, which together with the sclerosis lead to narrowing of the artery. Atrial thrombosis may occur at any site where plaques occur. Usually atheroma, and the reason for it is atheroma, and that is the deposition of fatty deposits at the inner walls of the arteries over time. And it is advised against that to do exercises, to be not overweight and not to eat over much. Stop smoking, exercise regularly, avoid overeating, keep good diet. Do not smoke, to do exercises and not to be overweight. Treatment in the home, none to the atrial thrombosis again. Treatment in the home, none. Consult the doctor at once. Okay, maybe you're going to say immediately consult the doctor if there's sudden pain and paleness. And what's the other thing also named? And coldness in the leg or something. What the doctor might do: arrange urgent admission to a surgical unit which can investigate the possibility of arterial graft, whatever the word is. I don't even know what it means. Prevention: do not smoke, do not overeat, and avoid being overweight. Okay, not smoking, not overeating, and not being overweight. What's the difference between overeating and being overweight? I mean, the first thing is the first is the eating part, but what is now in particular the difference for the atheroma, for the fatty deposits? Is it therefore important also not to overeat, even if someone is not overweight? It technically makes sense. The way the food is, we did within gastroenterology, the way the food is coming into the capillaries, the vitamins, minerals and carbohydrates through the capillaries in the intestine into the blood system. It makes sense. But also overeating could lead to atheroma even if no overweightness is present. But that is the big question: is it the case? Outlook. Arterial grafting has considerably improved the outlook for a localized arterial thrombosis. But if the whole artery is narrowed and diseased, surgery may be impossible or of limited value. The life of a limb will be in danger and amputation may then be necessary. That book is from the 70s, so we're going to stay away from that, maybe, or whatever. We're just going to say about the atrial thrombosis. Yeah, I don't know how it's pronounced. Atrial thrombosis. Okay. Atrial thrombosis, that is an artery shuts off, that, how to say it, clotting of blood in a short segment of an artery. It is obstruction of an artery leading of an artery. It can be any affected, mostly it is to an arm, leg or head, where was it? Blood, heart, brain and leg arteries are the most commonly. Heart, brain and leg, not arms. Heart, brain and leg. Heart, brain and leg. Okay. And the symptoms are an onset of pain and also coldness and paleness of the limb. And the person should see immediately a doctor. And the reason for it is mostly atheroma, that is fatty deposits developing at the insides of the artery walls, and to prevent atheroma and also within the atrial thrombosis, it is advised not to smoke, not to overeat, and not to be overweight. If we would go on, it would be, there are surgical options of grafting, whatever it means, but it can be also too much, and the limb has to be amputated. I'm going to start this in, can we? Atrial thrombosis. That is that an artery leading blood to a limb or to the heart or to the brain, usually these three parts are affected, is obstructed, so no blood flow more to the leg or to the heart or to the brain. The symptoms are onset of pain suddenly, and also coldness and paleness of the limb. And the region for it is mostly atheroma, and that is the developing or deposition of fatty deposits at the inner walls of the arteries. And it is advised to have it not smoke, to do sport and to exercise, and not to be overweight and to overeat. And that is according to Keith Hodgkin's Family Medical Advisor book on the page 79, but this is no medical advice. I want to stop the camera. And that was the medical part. If you were here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the stretching, and it's very risk. We're having the legs standing together, and we're doing the rooting tree exercise. One toe to the outside, other toe to the outside, and now the heels, and also one to the outside, and here, and toes, one more, as far as you can, and then back again in. Always one by one, but now stay with the head down, so go into the knees. Stay down and come slowly in again. And up. Legs or shoulder wide apart, maybe a bit more. Breathe in and lift the arms up. And breathe out, go over to one side. In again into the middle. And out back to the other side, or over to the other side. In into the middle. Out the arms down. Breathe again in. And out, and one hand slides down the leg and the other shoulder stays down. Breathe again in. And breathe out and take the arm over. Breathe in and out the rib cage. And breathe out back into the middle. Breathe again in. And out the other hand slides down the leg. The shoulder stays down. Breathe again in. And I will take one arm over. Breathe again in and out of the rib cage. And out back into the middle. Have the feet standing together. And breathe in and lift the arms up. Breathe out one arm down. And breathe in and reach to both ends. I can out. Breathe again in and reach high. And breathe out the arm down. Breathe in and reach. And again out, arm up. And bow down. Have your legs standing again, shoulder width wide apart, and we're doing shoulder circles. Again, back with the shoulders, up, in front, and down. Back, front, and down. And now in front, up, back, and down. So backwards. And now breathe in and lift the shoulders up. And breathe out and let the shoulders fall down. Again in. Out and down. Breathe in and lift the arms up. And reach always with one arm high up. Pretend to take an apple hanging high on an apple branch. So turn it a bit around and then to ship it out. And now the next exercise, the next right part, arms up to a T. Breathe again in. And breathe out and shift over to one side, but just with the upper part of the body. Again in. And out and out to the other side. Again in. And out, we're leaning onto the knees. Breathe again in. And out one shoulder in front. In and the shoulder back. And out the other one in front. In and back. And out, and we're hanging down. Just breathe again in. And breathe out the over to the leg. Breathe again in. Out over to the other leg. Breathe again in. Out back into the middle. Close the feet, but keep on hanging down. Breathe again in. And out. Breathe again in. And out comes slowly with the low back up and leg at the top and backwards. Shoulder round. The toes are pointing to the outside. We're having an ulnar length space between the heels. Breathe in and lift the arms up. And breathe out and sink down. Place the elbows against the inside of the knees and breathe again in and straighten up. And breathe out and come with the leg up. Breathe again in. Out and down. Breathe in and straighten up. And breathe out and come slowly in one straight line upwards. Hands again down. Next exercise, have a good standing leg, the heel of a mobile leg on top of the knee of a standing leg. Breathe again in. And out and sink down only if you can do it without an injury your knee. And up. Up and in. Breathe again in. And out and down. And again. Legs wide apart, and we're doing the trunk igniter. Breathe in, go down. And breathe again out. Again in. And out. One more round. Breathe in. And out. Again in. Out. Now breathe in and close the legs. And breathe again out. It was stretching. I thank you very much, and until next time.